a bit of new guidance for older people who have never had a heart attack or a stroke. Do not start a daily low-dose aspirin routine. This is new data. It was published in the journal JAMA, found that those who took a baby aspirin had a higher risk of developing a brain bleed, and it offered no significant protection against strokes either. This is because older folks are prone to falling, and falling can spark a brain bleed. Joining me now to talk more about it, Dr. Monica Gandhi, professor of medicine and associate division chief of HIV, infectious diseases, and global medicine at UCSF. So this is very new guidance. Does it apply to everyone? What's the data show?
Yeah, so just to remind ourselves, this applies to people who have never had a stroke or a heart attack. So remember when we used to use aspirin pretty frequently in everyone as what's called primary prevention to prevent a stroke in the future? This large study, it's called Aspirin, essentially randomized half of older people, 9,500 people, to getting aspirin 100 milligrams every day versus placebo. And they never had a heart attack or stroke, and then followed them out for about 5 years, 4.7 years, and said, was there any reduced incidence of stroke? And the answer was no, not significantly. And there were higher brain bleeds in those who were getting aspirin. So all of that put together means unless you've had a stroke or a heart attack, in which case that's called secondary prevention, and aspirin is important. For primary prevention, the risks are likely not worth the benefits. And the U.S. Preventative Task Force had already said, don't take aspirin if you don't need it, if you don't need it because you haven't had a stroke in the past. And this really reinforces that recommendation.
Understood. Important message. Okay. Officials in California are warning people in both Palo Alto and Stanford after mosquitoes in those communities have tested positive for the West Nile virus. Tonight at 10 local time, they're going to be treating the impacted areas to control the mosquito population. What's your warning about West Nile as we are in the thick of a hot summer?
Yeah, so West Nile virus, kind of came on a ship, actually, from England to the United States about 10 years ago. It's a virus that's spread by mosquitoes, and it's kind of endemic in the U.S., meaning we do see it in the summers. And unfortunately, it can be serious. People can get meningitis and other kind of CSF or central nervous system problems. So it's a serious disease. It's spread by mosquitoes. There's no treatment except to control mosquitoes. So the fact that it's been found in Santa Clara and Palo Alto means the only way is mosquito control. It's an old tried and true for malaria. And so yes, tonight at 10, they're saying, please stay inside because we're going to spray away for mosquitoes. If you're out and hiking and in these areas, wear long sleeved, use mosquito repellent. It's kind of going back to history in the 1900s. We really can't, mosquitoes bear illness, and we don't really have a huge malaria problem in the United States. That's not our problem. It's really West Nile is one of our endemic mosquito-borne illnesses.
Yeah, so bring the DEET if that's what you choose, long sleeves.
Yes.
You don't know which mosquito's carrying it, so you got to be careful. There's some new research finds many young children are not receiving potentially life-saving vaccines. 1 in 6 toddler-aged kids have not received all the doses of some of these early vaccines. That includes measles, polio, tetanus, Hep B, mumps, rubella. What is leading people, parents, caregivers not to get kids vaccinated right now? Is there a number 1, 2 reason?
Well, this study, which was published in Pediatrics last Wednesday from the University of Montana, is really important for us to say, okay, there's a lot of vaccines that you're supposed to get when you're a little child, and 72.9% of children are completing those, but not all the way. The issue is this was published in 2019. So this was actually before, meaning it's showing data from 2019. So this is actually before all this pandemic kind of distrust that's occurred. So we don't know at this point in 2023 if those rates are even lower, because what we've talked about on this program before is there's been a loss of trust in public health with vaccines in general, probably because all the noise happened. Like there was a lot of recommendations during the pandemic that didn't make as much sense to people, and then vaccines kind of were a side effect of some of that distrust. So I'm worried that the rates are even lower now, and we have to work on it.
Yeah. It's a joint effort and an important one. Dr. Gandhi, I'm out of time, but as always, thank you. Good to see you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.